Good afternoon, everyone. Welcome to this exclusive antenatal webinar organized by Huggies, aimed to help you prepare to care for your newborn child. Today, we are extremely fortunate to have two professionals with us on how to care for your newborn child. First up, we have Dr. Hua, who will be presenting on the do's and don'ts in the third trimester of your pregnancy. And after that, we'll have Juan Mazni, who will be demonstrating an infant massage suitable for your baby. Please be reminded, participants can ask questions as well. We will be accepting questions throughout the whole session via chat, and we will collect these questions and ask them at the end of the session. So once again, if you would like to ask your questions, please put the questions in the chat and we will get to you at the very end. So without further ado, please let me introduce Dr. Hua, who has an exceptional list of awards and licenses. He is also a member of the Royal College of Obstetricians and Gynecologists and is currently a consultant OBGYN at Kpjbatupahat Specialist Hospital. So I will now pass the mic to Dr. Lim. Doctor, are you ready? Oh, you're muted. You're currently muted.
Hello, everyone. Good afternoon.
All right. Okay, so I'll pass the mic to you. You may begin.
Okay. So, hello, everyone again. Thanks for joining us in this webinar. So, I'm extremely honored to be invited to talk about, to have this presentation. And today I'm going to talk about the do's and don'ts in third trimester. So, before I begin, I'm a consultant obstetrician and gynecologist at Kpjbatupahat Specialist Hospital. And well, a lot of people don't, aware is what is third trimester, because it's rather a scientific term. So to put it into a normal people's term, third trimester refer to the gestation, the time between 28 weeks to 40 weeks pregnancy. So from the 0 weeks, which is just right after conception, until 12 weeks of pregnancy, we refer it as first trimester. From 12 week to 28 week, that we call it second trimester. Third week will be 28 to 40 weeks. The reason why we divide into this different trimester is according to the stage of development of the baby. You can refer to the chart here. Up to 3 months, which is about 12 weeks, the baby is rather small, and the development will be mainly for the organ formation. When you look at second trimester, which is about 12 weeks to 28 weeks, then the baby will start growing in size. And the third trimester, the baby is growing even in a faster rate and prepared to be delivered. So frequently when I encounter patients, the first question they will ask, do I need to eat for two? That is actually a misconception, a myth that we need to blast today. Well, even though the mother is carrying a child or even two children, like in twin pregnancy or even more, it doesn't mean that you need to eat for two. What is the reason? When you refer to this chart, what is the extra calories that the mother need to have during first trimester? 0. In second trimester, there is also no extra calories needed. In third trimester, then you will need extra 200 kilocalories or 200 calories. And if you are breastfeeding, then you need an extra of 330 extra calories. But what is 200 extra calories? Are you going to choose what's it called, a sundae cone? This will give you 170 calories. If you choose to have an Oreo McFlurry, then you will gain another 338 calories. Well, I hope this is only for reference. I hope McDonald's won't mind and won't run. File a lawsuit case against me. But when you in third trimester, when you need extra 200 calories, then it comes to the brilliance of decision making. So there are so many types of food that you can choose. Instead of taking unhealthy food, extra 200 calories with an unhealthy food, might as well take a healthy food, which can give you extra 200 calories. You might take avocado, whole milk, or even half a burger or half a sandwich. Half a sandwich is equivalent to around 200 calories. And also, a lot of mothers will ask, what can I eat? What should I avoid? I mean, as a Chinese, you understand that there will be a lot of taboos when it comes to eating, especially during the first trimester. You can't drink cold drink, you can't eat fruits because they believe the fruit is cold. Well, when you come to Western medicine, we don't really believe in the whether cold or hot. As long as the mother should practice a balanced and diet with a lot of varieties. Later, I will show you the examples. What do we call a variety diet with a lot of variety? So, and again, avoid eating food that has a lot of sugars or salt. Put it into an easier term, try to avoid processed food. So this is the famous diagram that I think you will see at a lot of places. What are the things that comprises of a healthy diet? So in this part will be fruit and vegetable, and in the yellow part will be the potatoes and the starchy food. And here will be the grains and the proteins, and then the dairy alternatives. So for a general concept for a woman, the daily requirement of calories will be about 2,000 kilocalories. So, but there is also another thing is always there will be a confusion between kilocalories, kilocals and capital letter calories, which is actually the same. When you refer to 2,000 kilocalories, which is about 2,000 capital calories. So fruits and vegetables, this is the most important thing. You need to eat plenty of it, and preferably with different colors. Or there is another concept, we call it a rainbow diet. So well, you should try to at least take some yellow colored vegetables like the yellow pepper, the red pepper, then the green leafy vegetables, and orange color like carrots and beetroots. All these are good options, because fruits and vegetables, it provides not only vitamins but also fibers, because we know most of the mother will have some degree of constipation, especially during the third trimester. So taking adequate amount of fibers, that can help. And every meal, you should have some portion of fruits and vegetable in every meal, and it should be at least one adult handful. Okay, when you look at the Malaysian popular healthy plate, we call it suku separuh, or quarter half. So in your plate, at least half of the plate, half of the portion has to be fruit or vegetables, and a quarter will be protein, and another quarter will be carbohydrate. So then we go to meat, fish, egg, beans. These are the source of proteins. Protein is very important because it helps in cell building, muscle building. So you need to take it at least twice per day. So maybe breakfast, you don't have so much of protein, that's fine. It should include in the lunch and dinner. Very importantly, meat has to be fully cooked, has to be well done. So what we avoid is cold cured meats. So when you look at this cold cuts platter, most of it, a lot of it is actually not suitable, not recommended in pregnancy, like all the pate and sashimi, the Japanese food sashimi. All this is not suitable for pregnant lady because it may contain parasites. Or another very famous parasite is toxoplasmosis. Toxoplasmosis causes problem in the unborn child. It can cause brain damage if a mother infected or infested by toxoplasmosis parasites. And egg, very famous breakfast in Malaysia. We always like to have half-boiled egg with the toast, but it is not recommended in pregnant women. Half-boiled egg or even raw egg is it carries risk of a salmonella infection. Salmonella infection can cause bloody diarrhea and then can cause death or even preterm labor. And oily fish, omega-3, a lot of people, we know omega-3 is good for pregnant lady, but how much is adequate? in the terms of diet. So if you rather take oily fish instead of the capsule, it is recommended to take not more than 2 portions per week. The reason is most of the oily fish will be at the top of the food chain. When we say if the fish is at the top of the food chain, which means it is the predator fish, it eat other fish. So this big size fish will not only has a lot of omega-3 fatty acid, they do have a lot of mercuries, which is a heavy metal that is not good for the neural development of the unborn child. And avoid any liver or animal liver or liver products, because liver is the storage place for vitamin A. Too much vitamin A cause harm to the unborn child too. Next one will be the bread, rice, potatoes, all the starchy foods. So it is the source of carbohydrate, even though carbohydrate is not very good for, especially when you talk about weight management, but that is the source of energy. So you do have to take some amount of carbohydrate. It is recommended to try to make it into, try to choose wholemeal options or whole grain option. The reason is when you refer to this chart, when you talk about blood glucose level, I think a lot of mothers, they complain to me the worst thing they can imagine during pregnancy is to do the test, the sugar water test, or we call it the glucose tolerance test, because the sugary water is awful and they don't like. Okay, so when we talk about carbohydrate, you need to look at the GI. GI means glycemic index. What do we mean by glycemic index? That means how fast the sugar can be released from the food. So try to choose food with low glycemic index, which are the wholemeal and whole grains, because even though let's say when you are comparing a white bread with wholemeal bread, they contain the same amount of calories or same amount of sugar, but whole grain meal or wholemeal bread has lower glycemic index, which means the sugar will be released in a longer duration. So there will be no sugar surge. So the sugar will be released bit by bit. That can help in maintaining a stable glucose level. Because when you have such a surge, when you are eating the white bread with high glycemic index, there will be a sudden sugar surge right probably about half an hour to 1 hour after you take the break. Then the sugar level will then drop after about 2 hours. And this is a time where you will feel hungry, because hunger actually triggered by a sudden drop or a sudden fluctuance in the glycemic index. So that is not good to control your sugar level. So alongside with the starchy carbohydrate food, you should too take some fruits and vegetables. Then we go to the milk and dairy foods. It is a good source of calcium and vitamin D, which is very important for bone formation, bone development, and also maintain the health of the teeth. Try to choose the low or reduced fat version, because quite a number of mothers will think, now I'm pregnant, I'm carrying a child, I need to eat for 2, I need to drink for 2. So instead of choosing the low fat one, they will choose the whole, what they call the full cream milk. So actually there is not necessary. You just need to take the low or reduced fat version. And make sure the cheese or milk product has been pasteurized. This is very, very, very important. And because we know we will encourage all the mothers to take about 6 to 8 cups of fluid or water per day. So out of these 6 to 8 cups, probably you can replace 1 to 2 with milk. That would be a good option. And what to avoid? Try to avoid all the soft cheeses, especially the one with a white coating outside. This is one of the example. Or the blue cheese. The good thing is in Malaysia, I would say not many people are very practicing or like to eat cheese. So we don't see that much of a problem. But if you come to a cheese platter, try to avoid soft cheese with a white rind, or try to avoid blue cheese, or any unpasteurized cow's milk. And this is the commonly seen scenario in Malaysia, because there are places selling cow's milk, the boiled cow's milk, but we don't know how much the milk has been boiled, and we are not confident of the process of the processing method. So they might still contain bacteria inside the milk. So it is recommended to drink pasteurized milk or pasteurized cheese. For example, more commonly people will eat mozzarella or feta cheese, cottage cheese. All these cheese, even though they are soft cheese, as long as they are processed from a pasteurized source, that is fine. And they don't have a white coating outside, that is fine too. So, and then it comes to the problem with weight gain. Even before pregnancy, women are very sensitive to weight gain. But again, when you come to pregnancy, it becomes a dilemma, because it is always about, if you are gaining too much weight, is the mother going to have diabetes, or is the mother going to have a risk of developing hypertension? But if you're gaining too little weight, then you're worried about the growth of the baby. So how much weight to gain is considered as okay. When you look at this chart, this is the chart of a normal baby's growth. The first 22 weeks, you can see before 22 weeks, the baby doesn't really grow very fast, from 0 to probably about 500 grams across 4 months. But after 22 weeks, which is after about 5 months, then you will start to see an exponential growth of the baby's weight. This is a normal trend. So do not be worried if you didn't gain so much weight during the first 5 months of pregnancy, because the later 5 months of pregnancy, you will see the weight gain start to be speed up. So in the old concept, we always talk about you shouldn't gain more than 12 kg over the whole pregnancy. But now the new concept has come to weight gain or gestational weight gain. So it depends on how much of weight gain, it depends on how much of weight gain is allowable, depends on the pre-pregnancy BMI. So if before you get pregnant, you fall under the mother fall under the underweight category, then there is very much, the mother is allowed to gain about 12 kg to about 16, 18 kg throughout the pregnancy. But if your BMI falls within the normal range, okay, when you look at this brown color chart, this is the Western BMI. So we have to refer to the red color chart. So this is the Asian BMI. So if your BMI before pregnancy is between 18.5 to 22.9, then it's considered as normal, and you are allowed to gain about 12 kg over the 10 months or 9 months of pregnancy. But if you fall under overweight category, then it is understandable. You shouldn't gain so much weight. So throughout the pregnancy, probably you can only gain about 10 kg. So, but if a mother was obese before getting pregnant, then the mother can only allow to gain about 6 to 8 kg throughout the 9 or 10 months of pregnancy. So this is a new concept that we call it gestational weight gain. It depends on what is your BMI before you get pregnant. So then after we talk about weight gain, you know how much weight you can gain throughout the pregnancy. So how much can you eat every day? to achieve the goal. So, of course, there are certain mothers, they are very active before getting pregnant. So once they get pregnant, they will continue doing the same amount, probably just a little bit reduced amount of activity, but they still remain active. But there are also some mothers, they will be a little bit more laid back, they don't do so much of activity. So how much of calories you can take per day, it depends. It very much depends on your daily activity. So if you're doing a normal daily activity without any strenuous exercise for most of the day, or if you walk less than an hour per day, then you are considered as a less active mother. Then during the first 2 trimesters, which is up to 28 weeks of pregnancy, the daily calories required is only 1,980. But in 3rd trimester, as we know, we have discussed before, you are allowed to take another extra 200 kilocalories. Then in 3rd trimester, you are allowed to take 2,180 kilocalories per day. In the mothers who practice moderately active activity, what is the moderately active mother? They do normal daily activity with an hour per day of moderate strenuous activity. Then you are allowed to take a bit higher amount of calories, which is about 2,150 in first 2 trimester, and 3rd trimester you can take about 2,350 kilocalories. This is just a rough guide. I think it is not necessary to calculate the meal with calculator. It is just a rough guide to tell you how much calories that you can take per day. So for very active mother, of course, you can take higher calories. In 3rd trimester, you can even take up to 2,565 kilocalories, which is equivalent to the amount of calorie that a healthy man can take per day. So we talk about activity. Is it really advisable to do exercise during pregnancy? The answer is yes. In fact, the mother should do moderate intensity exercise. But what is moderate intensity exercise? That is the activity or the exercise that will allow you to move enough to raise the heart rate and start sweating. You can still talk normally, but you cannot sing. So this is a very good guidance to tell whether you are doing enough exercise, because even though we say exercise is good, I do not wish to see any mother to do exercise beyond their capacity and causing harm. So you should do moderate intensity exercise. And how do you know the exercise is suitable? The exercise should be able to cause you to sweat, but you can still talk normally during the exercise. And how much exercise should you do during pregnancy? The study has shown at least 30 minutes for every exercise, and 5 times per week will be the gold standard. If you do the calculation, it will be about 150 minutes per week. But we do understand that mothers, sometimes they are very busy with their daily schedule, especially the working mothers, or if the mother is a housewife, but there are a lot of house chores and other chores to take care of. So you can divide into a 10-minute session, about 50 times throughout the week. That will give you 150 minutes of exercise per week. If you are new to exercise, then it is advisable to start slow and gradually increase your activity according to your capacity. So is it safe to do exercise during pregnancy? Yes, but it is not for all mothers. So if you are healthy and your pregnancy is normal, you can always do exercise. If you are not sure, please consult your obstetrician. What are the benefits of doing exercise? Well, the Royal College of Obstetricians and Gynecologists UK has come up with their article about the benefit of exercise during pregnancy. Exercise reduce the risk of gestational diabetes, reduce the amount of gestational weight gain, and possibly it can protect you from getting preeclampsia. Preeclampsia is a condition of high blood pressure that comes along with protein in the urine. It is a very dangerous scenario or dangerous condition in pregnant mother, which may lead to preterm delivery or even a fetal death inside the womb, or even cause harm to the mother, for example, a hemorrhagic stroke, or even fitting. So exercise do have such, it is scientifically proven exercise brings this benefit. And it also eases constipation, reduces back pain. Back pain is because during pregnancy, the extra weight of the fetus and also the change of body gesture or body posture that can cause strain to the muscle at the back. So by doing exercise, it strengthens the muscle at the back that reduces the back pain. And it promotes healthy weight gain, and it promotes overall general fitness and strengthen the heart and blood vessels. And it helps you to lose weight after the mother gave birth. So this is very important. So it's not only important during pregnancy, it is also very important after delivery. So we have talked about who should do exercise, those who are with normal pregnancy and after you have consulted your obstetrician. But who are those not advisable to do exercise? The mother who has heart and lung diseases, the mother who has cervical insufficiency. This cervical insufficiency just means that the weakness of the cervix that can cause preterm labor. Or if the mother is carrying 2 or even more children, placenta previa means the placenta is at the lower side of the lower part of the uterus. History of preterm labor, preeclampsia, which is the high blood pressure, comes along with protein in the urine, or just high blood pressure, or severe anemia if your hemoglobin is less than 7. All these conditions, if you are having this kind of condition, then it is not advisable to do moderate intensity exercise. But you are still allowed to do stretching, the yoga exercise, which doesn't increase the heart rate, which doesn't put any strain on your heart. So you are allowed to do that. It is good for muscle relaxation, muscle strengthening, or even the relaxity of your muscle. So those kind of activity is allowed. So what are the precautions to be taken when you are doing exercise during pregnancy? Make sure you are well hydrated and wear appropriate attire. It is advisable to wear a loose-fitting clothing to prevent heat stroke, and avoid standing still or lying flat for too long. So when you look at this picture, inside the womb, there is a baby easily over 2 kg. So when you are lying flat, there will be a pressure of the pregnant womb pressing on the inferior vena cava, which is very big major vessel inside the body. And this then can cause a sudden drop of blood pressure, or even cause the interference of the blood supply to the baby. So it is not advisable to lie flat for too long or to stand still for too long, because it can cause a sudden drop of blood pressure. So what are the safe examples? What are the examples of safe exercises that you can do during pregnancy? The easiest thing will be brisk walking. And the next will be swimming, water workouts, and stationary bicycling, because you are not going out. I mean, the impact or the bounce will not be causing any problem. And modified yoga and modified Pilates. So contact sport is a no-no. Do not do any high impact exercise or contact sports. Okay, that is all about exercises. Then it comes to supplement. Same, a very frequently asked question in my clinic. So, doctor, is there any other thing I need to take? Any other supplement I need to take? Well, the most important thing, folic acid. Folic acid is essential for brain and nervous system development. But when to take folic acid? It is actually, ideally, folic acid should be started 3 months before becoming pregnant. So if you are planning for pregnancy, actually you should have been taking the folic acid 3 months before embark into pregnancy. If you find out you are pregnant and yet you haven't taken any folic acid, take the folic acid as soon as possible and continue taking it until up to 12 weeks of pregnancy. The reason is because the neural tube, the neural system will be well developed at about 12 weeks. So after 12 weeks, the emphasis is not so much on folic acid anymore, but it is always good to continue taking folic acid. How much is adequate? About 400 microgram will be adequate. 400 microgram per day, which is about 0.4 mg. But I think at the market, there are two dosage, mainly 0.4 mg and 5 mg. If you are taking 5 mg, that is fine because there will be no side effect if you are taking more than what you require. There are certain people require high dose of folic acid, 5 mg. Those who had a previous baby with spinal bifida, which is one of the neural tube defect, like this in this picture, you can see the nerve at the spinal cord is exposed, and there is a bulge here. This contains the fluid and the nerve fibers inside. So this is called spinal bifida. If the mother had a previous baby with spinal bifida or anencephaly, you can see anencephaly means there is no skull bone and a certain part of the brain is missing. If there is this previous baby with these conditions, then the mother need to take 5 mg per day. Or if there is any family history of neural tube defects, or the mother has pre-existing diabetes, means the mother has diabetes even before embark into pregnancy, then 5 mg per day is recommended. If the mother has high BMI more than 30, or if the mother is having epilepsy and taking medicine, or the mother is having HIV and taking anti-HIV medication, these are the people who need to take 5 mg folic acid. The next supplement we go to vitamin D. All pregnant women should take about 10 microgram, or if you are changing to units, it's about 400 units vitamin D each day. Breastfeeding mother is also recommended to continue taking vitamin D supplement because you are losing vitamin D and calcium in the breast milk. It reduces the risk of soft bones disease, which is rickets. Like in this picture, you see the long bone is softened and bowing. This is called rickets. So if the mother falls under the group of high risk of vitamin D deficiency, then a higher dose of vitamin D is required, about 25 microgram. Who are those falls under high risk of vitamin D deficiency? Those who are who has minimal sunlight exposure, which is very rare in Malaysia unless you are staying indoor most of the time, or those who are using high factor sunblock all the time. Dark skinned people has lesser vitamin D, higher risk of vitamin D deficiency because the pigment in the dark skin filtered or reflected the UV light. UV light is very important in converting or generating vitamin D in our body. So dark skinned people also fall under the high risk group, or mother with BMI more than 30. So there is a new concept about vitamin D and calcium, which reduces the risk of preeclampsia in high risk group. So if you have previous history of preeclampsia in previous pregnancy, you have preeclampsia, or you have other medical condition, for example, kidney disease or diabetes. So that makes you a high risk group of preeclampsia. So it is recommended to take vitamin D about 220 microgram per day with high dose calcium, 1.5 to 2 gram calcium per day. This can reduce the risk of preeclampsia about 40%. Iron. So iron prevents anemia. And when you don't have anemia, that can prevent you from getting preterm labor, fetal death, or excessive bleeding after delivery. Because if the mother is having enough hemoglobin, hemoglobin is the red blood cell. If you are having enough red blood cell, the blood loss during delivery will not cause so much impact. But to start off with low red blood cell, when you go into labor, a small amount of bleeding will cause bigger harm or will cause a greater impact because you don't have enough red blood cell to start with. So, but the problem with iron supplement is it is very difficult to be absorbed. For all the iron that you are taking, only 15% will be absorbed. And the side effect of iron, I think most of the mother will agree with me. Iron is very difficult to be taken. You will feel the metallic taste. You will have bloatedness. You might have lightheadedness after taking the iron supplement. And most of the iron supplement need to be taken empty stomach. The side effect itself is terrible enough, and yet you have to take it empty stomach. So that makes the side effect even worse. WHO recommend 30 mg to 60 mg of iron supplement per day. So there are so many iron supplements in the market. Which one should I choose? So when you look at this diagram, Obimin or Neo-Obimin or Obimin Plus, they are from the same company, contains about 30 mg iron. Sangobion also contains about 30 mg because we are talking about elemental iron. Elemental iron are the iron that can be absorbed. So if you choose the iron tablet with lower elemental iron, the side effect is lesser. So it is more well tolerated. So it is good for daily supplement. You can take 1 tablet per day or 2 tablets per day. But it's not good for a therapeutic target because you need to take, if we are talking about a therapeutic goal, a therapeutic dose of iron, you need to take about 200 and above elemental iron. So that means you need to take about maybe 7 or 8 tablets per day, which is too many. It is not rational. Then next one is the ferrous fumarate. This is the about the dark red or the dark brown tablet that are commonly given by the clinic kesihatan. It contains about 60 mg elemental iron, 1 tablet per day for supplement, 4 tablets per day for therapeutic goal. Next one will be Iberec, Zincofer, and Maltofer. All 3 options carries about 100 elemental iron. So 1 tablet per day for supplement, 2 tablets per day for therapeutic purpose. Maltofer is the only option or only supplement in the market that the company says you don't have to take it empty stomach. Maltofer is the one in this picture. You can see that. And it is the chewable tablet. It tastes like M&M chocolate candies. So it is the only one that you don't have to take it empty stomach. Omega-3. Again, a lot of people asking how much omega-3 is adequate. About 500 mg per day. It helps in brain development, but when you look at the study, what omega-3 fatty acid really does is it reduces the risk of preterm labor. it may reduce the risk of low birth weight, and it also may reduce the risk of preeclampsia. It doesn't talk about IQ. A lot of people thought that taking omega-3, my baby is going to have a higher IQ. It is not scientifically proven. And a lot of people convey the concern of omega-3 causing bleeding, especially if you are taking more after 36 weeks. But the latest study has shown that omega-3 doesn't have any impact on blood clotting mechanism, which means it doesn't really cause bleeding. So you can continue taking the omega-3. Vaccines, when the recent most popular topic is COVID vaccine. So what are the vaccines they are safe in pregnancy? All inactivated vaccines contain inactivated virus. All particles or subunit are considered safe in pregnancy. These are the examples. Later, I will focus on influenza and Tdap. So hepatitis B, hepatitis A are both safe in pregnancy. The vaccines that are not safe in pregnancy are the live attenuated. What do we mean by live attenuated? It means the vaccine contains bacteria or virus, but it is the weakened version. So for example, BCG, which is to prevent TB, MMR, and chickenpox vaccine, all these are not safe. When you look at this, very interestingly, influenza virus, but this is the nasal form of influenza virus. I don't think it's available in Malaysia. It is available in the US, where the vaccine is administered by nasal spray. So it contains a weakened influenza virus, not safe in pregnancy. But if you are taking the influenza vaccine by jab, that is fine. HPV, when you look at this HPV virus, HPV vaccine is not a live attenuated vaccine, but because there is no safety data, so it is not recommended if the woman is pregnant. So inactivated influenza vaccine is safe at any gestation. You can take it at any gestation. The reason why we are giving influenza vaccine is because if the mother gets influenza infection, the complication from that will be very severe. So it carries higher morbidity, which is it carries higher negative health impact on the mother. So it is good to receive influenza vaccine at any gestation. Another one is the Tdap, the new concept. The D stands for diphtheria. You can see the white coating bacteria infection over the throat. T is for the tetanus. Tetanus is an infection that can cause muscle cramping. And pertussis. You can listen to the very typical whooping cough of a neonate who gets pertussis infection. You can see the neonate will cough, 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 and there will be catching for air. Okay, so it is recommended to take Tdap vaccines at about 27 to 36 weeks of pregnancy. The reason is because when you look at the Malaysia immunization program, the baby will only complete the Tdap vaccine at the 5th month of age. So during the first 5 months, they are very vulnerable to this infection. So by giving the mother Tdap vaccine, it helps to protect the newborn first 5 months of life, that protect them from getting all these 3 infections. So then it comes to also one of the nightmare when you are about to give birth. You don't want to cut at the vagina, but how to avoid that? The cut at vagina, in medical term, we call it episiotomy. Episiotomy carries a purpose. Why we do episiotomy? in cases with tight perineum or tight private part, to allow the baby, to accommodate the baby's head to come out, we might need to perform a cut. And the cut normally is at the right side downwards, deviating the force away from the anus, because it helps to give space for the babies to come out, and then it also prevents a tear down towards the anus, because the anus is very important. The sphincter helps to control the defecation or control bowel opening and to control wind passing. So by cutting away, directing the angle of cut to be about 60 degrees away from the midline, that can avoid any injury to the anus. So how to avoid or how to reduce the need of performing episiotomy? Perineal massage is proven to be helpful. So this massage can be performed at third trimester, but not so early, about 36 weeks. So the mother can perform the massage by herself or can ask the help from the partner. Of course, you need to put some oil for lubrication. Try not to put mineral oil. So the Johnson & Johnson baby oil is not recommended because the mineral may cause clot on the pores. So you can use coconut oil, you can use the olive oil. All this is advisable. All this is recommended just by stretching, and that can cause that can improve the elasticity of the private part. So, and the last question, a lot of people may not be, may feel shy to ask is, can I have sex during pregnancy? The answer is yes. It is perfectly safe to have sex, except in condition like placenta previa, which is the placenta is at the lower part of the womb, or if your water bag has broken, or there is cervical insufficiency, which means the cervix is weak and may cause preterm labor, or if you are carrying 2 or more children. So, and during the sexual activity, you might have some mild contraction, but normally this kind of contraction does not cause labor. So, but it is normal to talk about it, and it is actually essential, very crucial. You need to talk about it. And the sex drive, your sex drive might change during pregnancy. So you need to talk about your feeling to your partner, and you might need to try in different position. The better position will be lying at your side. That reduce the discomfort. So that's all about the sharing today. Thanks for your time, and I will always put up educative posts in my social network, so you can have a look at my Facebook personal page or the Instagram. So is there any question? I pass the mic back to MC.
All right. Thank you, Doctor, for your very informational session. Okay, so we currently do have a couple of questions coming in from our participants. So for all our participants, if you have questions for Dr. Lim, now is time to ask. If just put it into the chat bar and we'll get to you. So one of our first questions is so I think this one is very important right now. If the mommy has contracted COVID-19, will it affect the baby?
Okay, COVID-19 infection during pregnancy, first is it carries higher risk of complication. It carries higher risk of ICU admission. It does increase the risk of preterm labor or even fetal death, but it all depends on how severe is the infection. So we do know that most of the COVID infection will be rather asymptomatic or just with mild symptoms. So in this category, it doesn't really cause harm to the baby. But if the mother is having a severe COVID infection which require ICU admission, that of course can increase the risk of preterm labor or fetal death, or the death of the baby inside the womb.
All right. Okay, thank you, doctor. So on to our other questions. There we have a participant asking, should a pregnant mummy, should they use a squat toilet, or is it more preferable to use a sitting toilet?
Well, actually, there is not much difference, because whether to decide of a label, there are a few things required, which is regular contraction and the opening of the cervix and the thinning of the cervix. So by squatting down, it doesn't really increase the risk of preterm labor. So that's fine. Either one is okay.
Okay, all right. So our next question is, if the pregnant mummy is already obese and she's only allowed to gain a very limited amount of weight during her pregnancy, will it affect the growth of the baby?
Normally, no. But again, that will comes to the method of choosing. So when we say you can only gain about 8 kg throughout 10 months of pregnancy, so instead of taking more carbohydrate or those processed food, so I would advise to take more healthy food with more variety. So fetal growth shouldn't be affected if you are practicing balanced, healthy diet.
Okay. All right. Okay, so our next question is, can mummies still continue to take folic acid and fish oil supplements even in the 3rd trimester of the pregnancy?
Okay. Folic acid is very crucial for the first 3 months of pregnancy, but it is no harm to continue taking folic acid until 3rd trimester. Omega-3, there is no specific time to start omega-3, but once you have started taking omega-3, then you can continue until until 3rd trimester. But my advice will be, because omega-3 is proven to reduce the risk of preterm labor and low birth weight and preeclampsia. So if you face the scenario which you are about to finish the omega-3 at 36 weeks or 37 weeks, there is no need to buy a new package, because you are term and there is omega-3 has helped you through the pregnancy. There is no point of spending money to buy a new package of omega-3.
Okay. All right. So we have another question from another mummy who asked, she likes to drink cold water every day. Will that actually have a negative effect on her baby?
No, yeah, it is absolutely fine. It is absolutely fine. As long as it's in water, it is not cold beer, that's absolutely fine.
Okay. All right. So another question. So can pregnant mummies lie on their stomach for back exercises during the 1st and 2nd trimester of their pregnancy?
It is not recommended to lie lie on their stomach. I will advise, if you are doing that such activity, it is preferably to be on all fours, means on your both hands and your knees, because you can do stretching by this one, crawling. It is not advisable to lie on the stomach.
Okay. All right. So another question on weight gain. A mummy is asking that, if the mummy has not gained much weight, but the baby has gained a lot of weight, does she need to do any kind of diet control?
Well, I think if it's that kind of situation, your doctor may order a blood test that is the oral glucose tolerance test, to check whether you have any diabetes. If everything is fine, then there is nothing much to worry. The doctor will monitor the fetal growth and the fetal size and decide the mode of delivery later, depending on the position and the size of the baby.
Okay. All right. And we've gotten quite a lot of questions regarding this. Pregnant mummies are asking if they will be able to take the COVID-19 vaccine.
Okay. up to this point, we have limited data on the safety of COVID vaccine on pregnancy. Because you see, if you are going to roll out a blanket order to say that all mothers must take COVID vaccine, you need to have a very huge data. So up to this point, we have some amount of data which shows COVID-19 vaccine is safe for pregnant lady. But since the data is not sufficient enough, even though it is quite promising, but we at this point, we only recommend pregnant lady who are working as a frontliner to have the option of choosing whether or not to receive the vaccine. So if you are a frontliner, then you can choose to take the vaccine or not. But please be assured that up to this point, most of the data, I would say all the data has shown COVID-19 vaccine is safe for pregnant mother. But if you are a general population and you are pregnant, probably you are not the priority in the list yet.
All right. Okay, thank you so much for that, doctor. All right, so I think we have time for one last question. So let's go with pregnant mommy is asking if a chiropractic Webster technique is safe for mummies during her pregnancy.
Chiropractic?
Yeah, so zhengu, you know,
Okay.
so where they chiropractors kind of like adjust your bones and stuff. So is that can pregnant moms actually go for that?
Well, I have no data on that, but I would not recommend chiropractic or chiropractic treatment during the pregnancy.
Yes,
because
the treatment, correct.
There are some place at the back that we are not supposed to have massage that can cause uterus contraction, that can start off contraction. So I don't normally recommend. So unless the chiropractitioner is very confident in doing this treatment.
All right. Okay. All right. So well, let's just do one last question. So one of the pregnant mummies is asking, do you have any recommendations, or what is your your opinion on traditional Chinese medications during the third trimester, such as like double boiled chicken soup and stuff like that?
So well, the chicken soup will be fine, but if we are talking about herbs, the problem is we don't have study on what are the chemical substance inside the herbs. So that brings us a lot of questions. So whether they, especially when you're talking about those herbs comes from underground, whether there is any traces of heavy metals, that we are not sure. So, but one of the things that I can tell is for the what's it called? There are certain herbs can cause blood thinning, can have blood thinning effect. So I don't recommend, especially after pregnancy, after delivery, I don't recommend mother to take Chinese herbs immediately because that might cause increased risk of bleeding. So Chinese herbs is fine, but rest for about 2 weeks after delivery, then only start taking the Chinese herbs, including the alcohol, because when they're during confinement, then you start taking alcohol to kind of like bring the heat to the body. But alcohol causes dehydration. So right after delivery, we know that the mother's blood will be a little bit thicker. So there is increased chance of blood clots, especially at the lower limb, or we call it the DVT, venous deep vein thrombosis. So this alcohol and herbs are fine during confinement, but please try to postpone it 2 weeks after delivery.
Okay, all right. All right, so once again, thank you so much, Dr. Lim. I think that's all we have in terms of time for our questions today. Thank you so much for your time, and thank you so much for presenting that wonderful presentation for us. But before we wrap up, Doctor, do you have any last words for our participants?
I think pregnancy is not a disease, so try to embrace pregnancy with positivity. Of course, there'll be a lot of, there'll be a lot of challenges, but try to share your feeling with others. And when you have any question, talk to your doctor. Doctors are always there to help you.
All right. Okay, thank you so much, Dr. Lim.
Bye-bye.
Thank you. Bye-bye.
Bye.
For our participants, you may find Dr. Lim on Facebook at his Facebook page, Dr. Lim Gynae. That's Dr. Lim, Gynae.